Now, at the risk of sounding a bit simplistic, because back pain is so universal, are there risk factors that one can look out for, risk factors that lead to back pain?
There are so many risk factors, especially those work-related risk factors. You know, like the truck drivers, those who carry heavy loads, those who work in industry where they have to carry loads from here and there, that involve twisting, bending. You know, those who work in construction industries, where you have these machines that increases vibrations, where the whole body vibrates. You know, those are the things that are being shown to encourage faster degeneration of the discs. You know, the discs, let me show them what the discs are. Okay? Like what the man is doing is quite dangerous.
What this man is doing is quite
dangerous.
He's lifting something. Can you tell us how to properly lift?
Yes, he is doing it well now because he has to bend his knees.
Okay.
We don't need to do it as we were doing it when we were young.
They taught us to bend our backs. You know, if you didn't bend your back, you were called a lazy person.
You don't need to overbend your back. You know, if you overflex your back, you know, there are structures that makes the bones of the back to be stable.
Okay, okay, this person is doing it wrongly.
This one is doing it wrongly. This one is doing it right. But it even depends on the weight of the load he is carrying.
Okay.
If the weight is so much, the pressure is on these bones, that part of them can either give way. You know, bones can fracture too.
Okay, if from carrying something?
Yes, now if it's so
not
heavy,
from a fall.
If it's so heavy, you know, it has the amount of load that it can withstand. Especially in elderly people where the bones are getting almost worn out gradually. You get what I'm saying?
Yes.
So there will be a compression fracture. The height will be depressed. You get what I'm saying? The height of the bone becomes so depressed.
The height of the bone.
The height of the bone. This is what I'm saying. This is a structure of the spine.
Okay.
Nature has made spine that is like a lazy S.
Okay.
Right? The neck is bent forward like this. The upper back is bent backward like this. And then the lower back bent forward like this.
Okay.
Such that gravitational force can be transmitted equally on both sides of the back, so that they won't encourage wearing out of these structures, which are the discs.
Okay.
These dark ones are the discs.
Are the discs, and in between are the bones.
They are placed in between the bones. And you can see the bones are getting bigger as you go down.
What is the job of these discs?
The disc is the shock absorber, like you have in cars.
Okay.
I just want to use a layman language. Shock absorber, and it has three parts. The part where it's joined to the bone here, internally, there's a gel-like substance, like those grease that we use in our shock absorber.
Yes.
And that is the most important part of the disc. We call it nucleus pulposus.
Okay.
That is the most important part. It's the one that resists pressure when it comes, because it has three components. It has proteins that is combined with glucose, which has the capability to absorb water, right?
Okay.
And then it has fibrous elements, and then it has water. So as one grows older, the water content becomes reduced.
Okay, so that makes the disc to be depressed.
Yes, because this is the strands that join them together. And when they are depressed, you know, when they are depressed, they become so weakened that there are areas of weaknesses within through which those gel-like substances can be pushed outwards.
Okay. So the
when
person begins to lose the gel from the discs.
Yes, it starts from early years.
And that reduces the shock absorbing quality.
It starts from the early years. I mean, right from the 20s.
Okay. And
then it grows that way. But it's not the same in every individual. Those who have genetic problems that involve the consequence of that disc, they wear out faster than others.
Isn't there a way to stop the wear out of the disc?
The only way is when the person dies. It's a natural phenomenon.
It's just going to happen.
It's a natural phenomenon, but the rate is quite different in different people.
Why? Why is the rate different? Is it because they're different people, or is it because they treat their backs differently?
You have just talked about risk factors now.
Okay.
For those who are engaged in those factors that I have mentioned earlier, they wear faster. The wearing takes place faster than others. You get what I'm saying? And then for those who are smokers, it wears out faster.
Okay.
Those who have other problems that can cause back pain, like infections, infection goes to destroy some of these things, including the bone. Fracture, if this bone is not stable,
which you have said can even be gotten from carrying heavy things, then the bone can fracture?
Loads. Yes.
Weightlifters?
Weightlifters do have stress fractures.
Oh.
They do have stress fractures, just like the soldiers have stress fractures when they march.
Back pain affects 80% of people at any point in time in their lives. So common. Now's the time that you can call in and ask your questions. The number to call is 0808 054 2233. That's 0808 054 2233. And if your tweets coming in time, they may be handled. We're still talking about back pain. Now, what I want to know is, what are these things extending out of the back like strings?
Okay, I'll just explain that. We have 7 bones in the neck.
Okay.
Those ones are cervical bones. 12 bones in the back, in the upper back. Those are the thoracic ones. And then 5 bones in the lumbar area, which we label L5. Though there may be variations in all this. We have seen people with 11 thoracic bones.
Okay.
And then people with 6 lumbar. And at the same time, part of the lumbar can join to the sacrum.
Is that why people sometimes seem to be taller on top than under sometimes?
No.
When you look at people, they say some people have shorter legs, some have taller legs.
No, it's not.
It has nothing to do
problem.
with that.
Yeah.
Okay.
So all these variations give rise to back pain. All these things you are seeing are the nerves that comes out at each
nerves.
level. Nerves.
Is it possible that the bones could actually impinge on the nerves and cause pain?
It's possible, and I'll explain it this way. When you have something that is in between 2 bones and is very stable, the shape of each segment of the bone and the attached ligaments, strands, and then the muscles of the back, they are the stabilizing factors.
We will come back to that in a minute. We are getting a call. Hello.
Hello.
Hello. Can we have your question?
Yes. Please, since 3 days ago, I've been having this serious back pain. And it started with a small something at my private part. And for right now, I can't even stand up from my bed. I've been having this serious back pain. I can't even walk. Please, what could be the cause, please?
Okay. Thank you very much, Boyega. Doctor, 3 days pain. I think the first question we ought to ask him is, have you seen a doctor?
Yes, he probably must have not seen. He says he's lying on the bed at home. But before I can make any diagnosis, he has to tell me how the pain comes about.
Okay.
That's what we call history, his own story.
Okay.
He has to tell me the story of the back.
Something about whether he has had it before?
Something about how it comes on. What was he doing before the thing came on? Some people will tell you it just comes on, just like that. They can't attribute anything to it. And then I have to examine him after taking the details. It's after that I can now say it's due to this or due to that, but I still need to do investigations.
Okay.
I could send him for a simple, plain X-ray, radiology of the back, and just to see the states of things. And I would have to know his age.
Oh, that too.
Age is an important factor, and the kind of work he does.
Okay.
I told you about some risk factors.
Carrying, lifting, vibration at work.
Even driving your own car. Most of the car seats are not properly, they're not back friendly.
Really?
Most of our car seats are not back friendly.